Good afternoon. Thank you all for being here today. My name is Tom Bates. I'm the Interim Commissioner for the Oklahoma State Department of Health. When I came to the department in April 1st, it was my charge to our staff that we would be ready as an agency to implement the requirements of State Question 788 should the voters of Oklahoma decide that that was their will. And last night they spoke, so since April we have worked for the last 3 months to develop a framework for implementing the requirements of State Question 788, and I am confident as the Commissioner of Health that this agency is ready to meet those requirements by the specified time, and that process will be handled with integrity. We are going to implement a medical marijuana model as required by the state question. Emergency rules governing the Oklahoma Medical Marijuana Authority, which is the name of the office within this department that we have charged with implementing this program, will be considered by the Oklahoma State Board of Health at their July 10th meeting. Application information and requirements will be available by July 26th for all of the defined categories of license, and the agency will begin accepting those applications no later than August 25th, again as required by the state question. Program information is available at the website omma.ok.gov. I would ask that the public keep in mind, I know there's a lot of interest and a lot of questions, but there's nothing that's going to be done today or tomorrow, or the public can do today or tomorrow. Those applications, as I've said, will be available in 30 days, and we will start accepting those in 60 days. There's no need to come to the state health department or to a county health department with questions or concerns about 788 or medical marijuana. Of course, folks having other issues, needs, or needing other health services, we want them to come both here and to our county health departments, but we do have work to do, and we want to manage the traffic coming in and out of our facilities accordingly. So just keep in mind that all relevant information will be posted on that website. Like I said, the application process will be available at the required time and will be enhanced in the coming months to make it more efficient for all parties. It will take some time to fully implement all of the steps recommended in preparation for this program, but we will continue to work to meet the letter of the law and to protect the health and safety of all Oklahomans. In addition to the website, we have established a phone number with a pre-recorded information, and that number is 405-271-2266. As I've mentioned, on that website, there is a link to a draft of administrative rules. Those rules are a work in progress. They're a draft. There is a link on the website that allows for public comment, for us to get that feedback from the public to hear what they think about our draft, as well as an ongoing conversation with our agency partners that have interest in this, and that includes our medical licensure boards, law enforcement partners, pharmacy board, OMES, everyone that has an interest or a concern in this process or in this program. Those conversations are ongoing, and those rules are subject to change between now and what is actually submitted to the board on July 10th. Before I get to questions, I would like to just express my thanks and pride in the staff of the Oklahoma State Department of Health and the great work they have done from April through last night in getting ready for this and getting ready for this day. We didn't know if the state question was going to pass or not, and it was not our job to express an opinion on that one way or the other. But again, as I said, the charge to them was that we would be ready if that was the will of the people, and we have answered that bell. Three of the folks that were intimately involved in that are here today. Adrian Rollins, Melissa Miller, and Julie Azell, our general counsel. So I open it up to questions now, and
Commissioner Brett Agansky, KOCO 5 News. We interviewed Governor Fallon just a little bit ago, and she had some concerns about State Question 788. This is her quote, her words, not mine. The process of just setting up a statewide system within 30 days is not really reasonable, so we got to figure out how we can make the process flow right with regulations, with rules. Do you agree with that?
I understand the governor's concerns, and we'll be meeting with the governor and her team later this afternoon. And the governor and the legislature, they have, they can make certain decisions, and that's absolutely their right, and we will comply with with their wishes. We have to be ready. I mean, the state question as drafted puts certain requirements on this agency, and we have to be ready. So the discussion should be what is in the best public policy interests about the implementation of 788, or the desires of the people as expressed last night, not about the readiness of the state health department to implement the program. Well, the rules that we'll be submitting to the legislature, the rules that we will be submitting to the board are emergency rules, which, on an emergency rule basis, those only have to be approved by the governor, the board, and then the governor. Permanent rules will then require the approval of the legislature.
When is the point do we reach the permanent rules stage?
That would be going into the next legislative session.
Oh, so 2019?
Yes.
So is there any need potentially for the legislature to meet for the health department, to meet the health department's needs for this?
Like I've said, we stand ready to meet the requirements of State Question 788 as written. Obviously, would it be nice to have more time to have the most robust online system available that was interoperable with law enforcement and all of our potential partners on day one? Yes, I mean that would be ideal. But we stand ready today to implement the requirements of the state question.
What sources did the department tap into to develop the framework?
Well, other states that have already gone through this process, and again, our other agencies, law enforcement, medical boards, and so forth, who have their counterparts in states that have implemented medical marijuana. So again, try not to reinvent the wheel, but keep in mind, State Question 788 is somewhat unique. It wasn't always an apples to apples comparison. So we tried to be informed by the experience of others, but had to flesh out some of this based on the feedback we had from our agency partners and stakeholders.
Now, the governor said that it's too broad. She wants it specifically tuned so that it deals with medical issues. Do you have to look to the legislature for that, or can you adjust rules? Do you want to adjust rules to make it more specific on medical?
Again, and I don't want to make it sound like I'm being evasive here, but there are certain public policy issues surrounding medical marijuana that it is the absolute right of the legislature and the governor to weigh in on. And if they choose to do that, we will do as we're instructed, absolutely. But again, my message today is that this agency, given all it's been through, the ability of this agency to implement 788 as passed should not be a factor in that discussion. We stand ready to do it, to do the job.
Will you lobby with the governor and the legislature to see more strict interpretations of the rules and more specific set of guidelines as to who?
I am the Commissioner of Public Health, meaning I implement policy.
Yeah.
I don't set policy. So whatever the elected policymakers of this state decide, that's what we will implement.
Will the special interagency committee be meeting again prior to the July 10th board meeting? And then now that the question has passed, will that body continue?
I don't think we have a meeting scheduled for that group. We have asked them to provide, we have circulated the draft rules to everyone that participated in that, and we have asked them to give us their written feedback on the draft rules by this Friday. After we get that, review that, then we'll decide if we, if we need to have another meeting.
Can you give an example of the emergency rule you were just briefly touching on a little earlier? You said something along the lines of there are emergency rules.
Right.
Can you just give an example of one or two of an emergency rule?
Well, emergency rules are promulgated by agencies in state government routinely. And they do that for a variety of reasons. And then at some point, the permanent rules are promulgated that are reviewed by the legislature.
I realize that, but I'm saying, can you give an example of an emergency rule that in this case?
Well, I can speak from my own personal experience. Back in 2002, when the Attorney General's office implemented the don't call registry, we implemented emergency rules governing that program as well. And there are a variety of emergency rules. Our general counsel can get you more specific examples, but agencies routinely enact emergency rules.
What you have on the website are the emergency rules.
Right.
The list you have are the
Right.
emergency rules.
That draft is the proposed emergency
In
rules.
2019, the legislature will come back and decide if they want to adopt the emergency rules or pass their own. Is that correct?
That's correct.
Commissioner, what kind of manpower is this going to take in order to look at all the licensing? And does that mean that OSDH could hire more people in the future?
Yes, I mean, we will need more manpower to do this. And one of the things that we're working with right now is what are our IT capabilities over the next 60 days. We'll try to do as much of this online as possible, but this is an incredibly tight time frame for our partners at OMES as well. And so we'll be working with them to determine the best system. If we have to launch with a more paper-based system, that will require us to hire more manpower, more temporary type employees to do the data entry and process these applications.
And when we're talking number of employees?
I think it could, easily. I think we could approach 100 employees that we would need to get this done. As far as, like I said, these are largely clerical, like temporary type of employees. While we wait for that more permanent online system to come online.
Have you made any projections about what kind of demand for applications there'll be?
I mean, that is solely based on activity in other states, and that has run the gamut. Melissa, do you have those numbers?
I think we were thinking a range between 40 and 80,000. I know it's a broad range, but kind of looking at other states.
And that's patient license applications only.
That's total.
Total, okay,
Majority would be patient.
right.
Do you have any indications as far as phone and web traffic now that there's this landslide of?
It is my understanding, and Brian Downs, my chief of staff, can weigh in more, that we've had 200,000 Facebook hits already on social media alone. We've received around 90 phone calls. I don't know any other data on that, Brian? Okay.
Will doctors have to get
A lot of
special-
interest, obviously.
Will doctors have to get special permitting or licensing in order to prescribe? They have to sign off on the license, right? So they apply.
Right.
Doctors have to get any special?
Those are issues and works in progress. I mean, the state question doesn't talk about a qualifying condition, but we are engaged in conversations about what type of training and so forth should doctors be required to go through before making these decisions and signing off on these licenses, and how do we implement that in those rules? We're still dealing with that.
You set a timeline for people to submit their applications and be processed. Do you have any idea when product will be available, when people can say, I will be able to actually get medical marijuana?
Randy, that is a bit of a work in progress. There's a lot of factors in play. I could not begin to speak on behalf of industry stakeholders once they get licensed, how long it would take them to establish their infrastructures and begin to serve patients. That's an unknown to me.
It all has to come from Oklahoma, as I understand it.
That's correct.
Product. So, two questions. How do they get the product in to begin with if it all has to come from Oklahoma? And you don't have any idea how long it
Well,
takes?
obviously, there has to be an exception. I think Julie's looked at this a little more. There has to be an exception to get that initial seed into the state, correct? But we'll work that out and get that into our rules. So, but yeah, after that, it all has to be be grown, processed here in the state of Oklahoma.
Takes months likely to do that, or?
Again, Randy, I'm not an expert on the growth and the cultivation of marijuana, and but I'm learning more about it every day. And it's my understanding that with the current industry and what they have at their disposal with the industrial type of growth, that they can grow fairly quickly, but I don't know those exact timelines.
And other states that you looked at, the framework and emergency rules, I mean, has any other state done it as quickly as Oklahoma will have to do it? And what's the shortest time that other states have turned this one out?
I don't know that exactly, Paul. I think we could probably get that for you. But it is, I think we probably are definitely up there as far as the tightness on the timelines.
And given the number of states, do you have a pretty good framework, pretty good skeleton to go with, given so many other states have already been there?
Yeah, I mean, we have definitely tapped all of those. We've I think visited with 10 other states in their programs, and we've tried to run as many traps as we can and learn from their experiences, both good and bad.
What has been the biggest challenge in great cracking the rules?
I mean, I think, again, there are certain things that 788 does not speak to. And you asked earlier about like what are the appropriate guidelines for a physician to do this. Other areas as well. I mean, one of the concerns I have is marijuana is not a part of our prescription won't be part of our prescription monitoring program. And we've received a lot of feedback that it should be, but those are all things that require statutory changes in order to implement. So there are some gaps in 788 the way it's written, no doubt. And it would be helpful at some point to get the guidance of the legislature on those. But so we just have to do the best we can with the state question as it's passed.
Now, there's a possibility that you could be denied a license. Can you kind of talk about the rulings that you guys have thought about on the people that could possibly get denied?
Well, I mean, I think that will just kind of have to evolve right now. We're at a point where we're finalizing the applications and begin accepting applications. State Question 788 is very broad, and it says if a board-certified physician believes that a person needs it and is willing to sign off on that license, that's what the state question says. So what would lead to a denial? I mean, we'll just have to work more toward that.
Is there anywhere that people are not going to be permitted to grow marijuana? Are they going to allow to grow at churches to get revenue, or nursing homes, or?
Well, that aspect of the state question, of allowing private individuals to grow, it's in the state question, and we've tried to deal with that as artfully as we can in our draft rules. We will continue to get feedback on that very issue, and but it is a very broad area right now, and that is an area where honestly there are still a lot of unknowns about how that might actually play out in the real world.
So could an elementary school science teacher grow it in your science classroom?
Well, I think we have some things in our rules that will deal with those kind of scenarios. So.
Do you anticipate the health department keeping this authority under its wing or spinning it out to something separate completely like the Aid Commission?
Again, that's a policy decision for the legislature and the governor. Again, my message today and to the legislature and the governor is that we stand ready to do our job. If they decide that this work is better done in another agency or due to the creation of another entity altogether, that's their call, and we respect that. Any other questions?
If you have kind of like you're in a Wild West situation here and shoot from the hip, and it seems like you guys have got an awful lot to take care of in a very tight window with an awful lot of big wide question marks.
We do. We do have a lot to take care of in a tight time frame. But again, here's and it's going to take it's a heavy lift, and it's going to take a lot of work. But again, my job as the interim commissioner, is to make sure that this agency stands ready to carry out its statutorily obligated functions. And the state question last night, we had another function added to our load last night. So we have to be ready, and that's, you know, I'm not here to making excuses or in any way asking, you know, say poor pitiful health department. Again, that was our charge, and we stand ready to carry it out.
Are the finances there to pay for it all?
Well, I mean, obviously the concerns about this agency's finances are well known. There's the audit report and so forth that has come out. There are obviously, you know, funds available from that supplemental appropriation. So if the legislature does not come back and extend timelines or take action, then I take that as that they intend for us to use funds that we have available to us to implement this program.
Are you willing to share how you voted on this state question?
You know, Paul, that's not really my opinion on this. Doesn't matter, because I'm the hired help here. Okay, I'm here to implement something. You know, to implement a program, and I'm going to do that fairly, and this agency is going to do that fairly, and we're going to implement the will of the people as expressed last night in that vote on that state question.
Are you getting a lot of input from the industry itself, the growers?
We have heard from them, and we will continue to hear from them, and we will get their feedback as well. They're obviously a stakeholder, and we will get their feedback on our emergency rules as well.